My name is Michael Benefield. I'll be conducting an assessment of the head, face, and neck. This is for Albany State University BSN program. First thing I want to do is I want to start by assessing the scalp and the skull. And so I'm going to visually inspect for any abnormalities, any issues with the hair, any lesions, any swelling, and I'll physically palpate for any lesions, any swelling, and abnormalities that I'll note. Next, I want to move on to the face. When I'm visually inspecting the face, I'm looking for any lesions, any swelling, and abnormalities. I want to make sure that the eyebrows are symmetrical, the nasolabial folds are symmetrical. I'm also looking to make sure that the facial expression corresponds with the patient's current mood. After that, I want to physically palpate, looking for any lesions, any swelling, abnormalities, and I'm going to tell the patient that I'm going to palpate their sinuses. And so I'll start with the maxillary sinus, and I'm going to apply gentle pressure, and I'll ask them to let me know if they note any pain.
No.
Moving on to the frontal sinuses. Any pain?
No.
Next, I want to move on to assessing the patient's lymph nodes, and I'm going to start in a symmetrical fashion, and I'll start with the preauricular lymph nodes. Moving on to the posterior auricular lymph nodes, on to the occipital, to the submental, the submandibular, moving on to the tonsillar, the superficial clavicular, the deep cervical chain, posterior cervical, and on to the last set, the supraclavicular. Okay. The next thing I want to check for is I want to check for range of motion, and so I'll get the patient to take and see if they can touch their chin to their chest, and I'll ask them to go ahead and put their head back in neutral, lean his back as far as they can, and I want them to touch their ear to their shoulder to the left side, ear to the shoulder on the other side. Okay, and then we're going to turn our head to the left, turn your head all the way to the right, shrug your shoulders. And then the next thing we're going to do when we're looking at cranial nerve 11 is we'll take and I'll apply gentle pressure on the shoulders and have them shrug again. Okay, then I'm going to place my hand on the side of their face, have them push away. Same thing to the other side. The next part I want to do is I want to take and I want to assess the carotid on both sides. Inspect and palpate. And if I felt any abnormalities at this point, I would go ahead and I would listen for bruit. And so I'm going to listen at this time, and I'm going to advise the patient to have them hold their breath while I'm listening with the bellow of the scope. Hold your breath. Breathe out. Now I ask them to hold their breath again. Breathe out again. Lastly, we're going to move on to the trachea. And I want to make sure that the trachea is midline, that I don't note any abnormalities upon inspection or on palpation. And finally, I will take a glass of water. And with my glass of water here, I'm going to stand behind my patient. I'm going to position my hands on both sides, and as they swallow, I'm going to assess their thyroid gland, noting any goiter or any pain upon palpation. Go ahead and swallow for me. Okay, and I can palpate the thyroid on both sides there. It feels normal. This is going to conclude my assessment of the head, face, and neck. Thank you.